Greetings and welcome to the weekly educational round at Sinclair, where every week we present a educational opportunity and activity where perhaps out there were maybe some things you've never experienced or never heard of before. And today I am Jim Ellermeyer. I'm a behavioral health therapist here at Sinclair, and today I'm joined by
Sarah. I'm a PA student.
And
Renee Farah. I'm a registered nurse and a certified energy health practitioner.
And today Renee is joining us as our topic for today is energy balancing and thought field therapy. So Renee, could you tell us a little bit about your background?
Well, I started in 1999 with Reiki. I became a Reiki master, and just in the journey through life, learning to deal with stress myself. I was a single parent working full-time. Sometimes life just seemed a little bit overwhelming, and looking for tools to help me manage stress, I came upon thought-field therapy back in 2007, and I was so amazed with how well it worked. It was very quick, dramatic. Some of the items I would work on would change in an instant and be almost permanent. So being excited about it, I decided to learn it, get certified, and be able to share it with other people. I had the opportunity to become an RN to hopefully combine this with is an integrative practice with traditional Eastern medicine.
Well, sure. And sometimes here at Sinclair, where we deal with alternative methods and interventions, they're all well documented and empirically validated. Sometimes here in Western allopathic medicine, when something becomes present and available, they believe that they discovered it. However, some of the things that you do are based on well documented. Could you tell us a little bit about that?
Well, first of all, there's a term called energy psychology, and that is an umbrella term that covers several modalities: thought-field therapy, emotional freedom technique. What is nice, these are evidence-supported modalities that help balance, restore, and improve human functioning by combining two things. One is physical interventions, which we use our fingertips to tap or rub on acupuncture points that have been documented for thousands of years. And second of all, then it combines with more modern and cognitive interventions because you use imagery, you bring to thought the items in situations that are bothering you.
Many of our viewers out there perhaps aren't familiar with the term tapping. Could you explain that, please?
Well, it could be easier just to show it, but there are several points on our body. We have acupuncture points on the eyebrows, side of the eyes, under the eyes, nose, mouth, on our trunk and fingers. So you would use normally 2 fingers. You would tap with a light pressure. You don't want to bruise yourself, normally 7 times on the spots. So eyes. For example, in situations to release fear in thought-field therapy, the algorithm we would use, or the combination, would be the eyebrow, under the arm, and the collarbone.
Could you explain to us the significance of these particular points that you're tapping?
Well, again, this is based on acupuncture, where the points are directly connected to certain organs in the body, and those organs are related to emotions.
Well, I know that Sarah has expressed some interest in the energy balancing and thought field therapy, so I'm going to ask her if she has anything that she'd like to run by Renee.
Yes, I just want to know what can people expect after they do get this sort of treatment.
Well, of course, you know, with this, there's no guarantee of what can happen. We can't claim that it cures or prevents any diseases, but many times people will experience a reduction in the emotional charge. So, for instance, if you had an altercation with your boss and maybe you come home and you're enraged, you can use the tapping, possibly bring that down to a 0 where You can think about the situation, but it doesn't trigger the emotional response. Then that leaves you to be able to look at the situation and make better choices. A lot of these times, you can bring a emotional disturbance down from a 10 to a 0 relatively quickly, maybe in 10 or 15 minutes. Other times, if it's a long-standing energetic pattern, it may require more treatments. Each time that you work on an issue, then the distress could gradually lessen over time. So really everything is individual.
And what is the success rate for doing these types of treatments?
In the clinical settings, psychologists have found as high as up to 95% successful in reducing the negative emotional charge associated with thoughts of the past, present, or future. And again, what can happen is it can be permanent, but maybe a new aspect of a situation may arise that would need to be treated.
And are there any risks?
This is pretty much risk-free. There are a few risks that I like to tell people about. One, when you are tapping and you're getting the body to relax, some repressed memories or feelings can start to surface, but you can work through that relatively quickly. Also, I like to tell people, since it's stress management, is to keep in touch with their doctors, because anytime you're learning to relax, so you have hypertension, other medications you're on, antidepressants, maybe in time they need to be adjusted, and hopefully at some point you may be able to eliminate them.
Okay. And is there research that supports these techniques?
There's an organization that I belong to and that I was trained with called ACEP. It's the Association for Comprehensive Energy Psychology. They are involved with ongoing research. Now the National Institute of Health, the Kaiser Foundation, and even the veterans are starting to do research with the thought-filled therapy. It showed a lot of promise with post-traumatic stress and even being used with our veterans.
Well, thank you. That was really informative.
You mentioned earlier, Renee, that you developed an interest in this field as sort of a personal type of growth, personal journey. Without going into great detail, could you share a little bit of that, please?
Well, again, being a single mom and having to work, when you go through a divorce, it rattles your self-esteem, fears of moving into other relationships, and so I used that for a lot of those issues.
Could you tell us where you became interested in this at? Where did you find it?
Well, my instructor was Dr. Gregory Nicosia, who's a neuropsychologist here in Pittsburgh. He's also past president of the ACEP organization. So he ended up being my mentor and does conduct a lot of training classes for people that want to learn how to do it.
Well, here at Sinclair, we attempt to provide alternative treatments. We take a holistic view of mind, body, and spirit of an individual. Our goal is to have as few chemicals in a human's body as possible. There are certainly times when medications are necessary, but I don't see much of a problem with your own tapping, the own physical sensations, your own fingers.
Right, and that's what the side effects, are really virtually none. Well, here's one experience that I remember with myself in doing thought-filled therapy, and most women may be able to relate to this, but there was a day I was overly emotional, and I related it to PMS symptoms. And it's so easy to say, oh, it's PMS, if you're tearful. And I walked in and I had somebody do a thought-filled therapy session on me. And I was amazed because I walked out of there laughing and in the best mood. So in a quick half-an-hour session, something that I thought was hormonal was turned around.
So what you're telling us is this works not only in others' lives, it works in your own.
Definitely. I find it I try to do this on a daily basis, just like brushing and flossing teeth. I think it's a very important part of daily health practice.
Now, when you're doing this, do you tap another person, or you teach them to do it on themselves?
There's a couple levels of thought-filled therapy. First, it is the basic self-care, which you would hear that term as emotional freedom technique. It's very generic. You tap on all of the points. The next level would be something that I do. I work with more common everyday stressors. There is a new level that I start to look at a person's polarity, which is like the positive and negative field, just like a battery, because that has to be aligned. And then the next level would be with more serious conditions like schizophrenia, PTSD, major depression, bipolar, that more a licensed mental health practitioner would have to deal with.
And recently you've become affiliated, you've become a staff member here at Sinclair.
Yes.
Now tell us about how you got here. Tell us why you're interested in being here at Sinclair.
Well, having my RN and being certified as an energy health practitioner, I wanted to be in a place that would welcome and allow me to expand on both of those. And I had the wonderful opportunity of meeting Dr. Chaudhry at a talk that he was giving. And he invited me out to check out the place, and I fell in love with it. I think what they do here is just fabulous, combining food, meditation, and really integrating many aspects for a holistic healing.
And we do have a question that was called in, Renee. It's why does tapping work, and how does it release emotions?
Well, that's
kind of a broad question. Yes.
Yeah, and maybe I need my son here, who's an electrician. But you know, we have meridians, which subtle energies flow through, and emotions can get stuck in those. And by tapping, you know, I almost think of it as having like a little plunger in a clogged drain. So we are sending electrical impulses to open those channels up so everything flows.
That sounds reasonable. And also, I understand that this Wednesday you're going to be here at Sinclair offering some
free
treatments. Yes. Could you tell us
I have
about
6
that?
openings. I will be here from 10 a.m. to 3 p.m. So they will be free 45-minute sessions. So you have to get them while they're there. And I would be happy to work with anybody. And one item, though, that I request, because if there are issues that could be a little bit more serious, I do like the person to be under care of, you know, a licensed medical or health practitioner.
Well, sure. So then you'll be scheduling. You have an opportunity for. There are 6 open slots. Renee is going to be having a free 45-minute consultation, and that'll be Wednesday, August the 6th, from 10 to 3 p.m. here at Sinclair at 341 Story Road in Export, PA. And you can schedule an appointment by calling 724-468-3999. Renee, we're glad to have you on board.
One other thing I want to make with the appointments, though, it is important. There is an informed consent that needs to be signed and an assessment form that needs to be filled out prior to the visit.
Sure. So when you make the schedule, if you'd arrive about 20 minutes early, that'd be just great. I'd like to thank Miss Sarah here today, and I'd like to thank Renee and welcome aboard on the good ship Lollipop. So and as always here at Sinclair, we're always asking folks, please be good to yourself. Fruits, nuts, and vegetables. Perhaps unplug the television and take up some fishing. And Sven and I often fish without bait. So until the next time.
To continue the conversation, please like us on Facebook, plus on Google+, and follow us on Twitter under Sinclair Life, and keep an eye on any of these for our next live recording Mondays around noon to ask your own questions. You can also find this and other Grand Rounds on youtube.com/Sinclair Video, and find audio versions on iTunes, Stitcher, Spreaker, and iHeartRadio. Please visit us at www.sinclair.com for more about us and other articles on our great blog.
Until next time, I'm going to ask you what time it is, and it is always right now.